Okay, well, thank you, everyone. And that was El Paso. And this is supposed to be up for 7 seconds, so I'll tell you I have no disclosures, but I'm going to use this time to see how many people are fellows or residents right now. Okay, so this might hopefully help you. You know, I don't have any special expertise in this other than being coming from the School of Hard Knocks. My first job, you know, I was talking to the CEO of the hospital, and he says, well, how much you want to make? And this was about 12 years ago. And I said, well, gosh, maybe $225,000. He shuffles and he looks around and he goes, I guess we could do that. And that was a $150,000 mistake that I made right then. So one of the things I'm going to talk to you about is how to value yourself and how to really think for yourself and be an advocate for yourself. So you made it, right? Well, close, the residents and fellows, you kind of made it. You just got an NFL contract. You really did. I mean, when you think about this, you know, over a period of 25 years at $300,000 a year, conservatively, it should be at least $300,000 a year starting, you're going to make $7.5 million. It's a lot of money, right? And what's the average life of an NFL player? You know, he's like 5 years in the NFL. But you're going to do this for 25 years, you're going to make about $7.5 million. But your body's going to make you pay just the way that the NFL makes them pay. You're going to have pain chronically. You're going to have shoulder difficulties. You're going to have lower back pain. You're going to have foot pain. So you're ready for all that hard work to pay off, right? But how's it going to go? Are you going to be this guy who now is unemployed because the AAF or whatever it was already closed, the new football league? You guys know who this is? Johnny Football? Spectacular disaster story. Or do you want to be this guy who is Patrick Mahomes from Texas Tech, who was MVP of the league last year and is going to cash in on that contract? He played in the Super Bowl his second year in. So how do you maximize your potential? And I think this is going to be a super key thing for you. Again, I'm not going to give you sort of pearls of wisdom falling from my mouth. I don't have anything like that to offer, but I want to give you some brass tacks. And it's a business, and the sooner you get that into your head and the sooner you really think about the money that's involved here and the money that people are making off of you, the better negotiation you're going to make and the better contract you're going to make. And we're like, oh my gosh, you know, I'm a doctor, you know, I have the moral high ground. And it's like, no, you don't. You have to leave that thinking out. You are just a plug or a piece to them in their system. And when you start thinking of that and you think of your worth as that piece of that system, you'll be able to negotiate a little bit clearer. And you'll have your goal in mind. So you got to take care of number one. And I know it sounds weird because, I mean, they don't even talk to you. I have residents. I'm in solo private practice, but Texas Tech sends me residents, medical students, and that's not part of your medical education. But your decision is going to have long-range ramifications, and your difference in your negotiation and how you do this might be the difference in between your kids' private school or public school, or maybe you retire 5 years earlier, or maybe you I don't know, get a new car, a new house. These are big things, and they make a big difference in your life. So there's three models. You can be a hospital employee. You can be in a large group, which is also kind of an employed position, although there's different models of that. You can be in solo practice. I'll talk kind of about the first two. Solo practice, probably nobody in here is planning to do that, so we'll just kind of quickly go over that. But what about all that altruism? What about you're a healer? You know, oh my gosh. But you got to separate business from ethics. You can have the moral high ground, just not in the C-suite, because that's not what they're thinking about. Goodwill is worthless. So, you know, I've known, you know, for a while, we were fellows together, but and he sounds like he's got a good situation when the administrators are playing straight with him, but you need to trust them, but you need to verify that. So, you know, we all have this feeling of ourselves in the OR, but, you know, real life kind of comes in like it's a sterile field. Got to get out of there. So first things first, right, yeah. First things first is you got to get a license in the state you're interested in. That's I guess it probably doesn't need to be said, but I'm going to say it anyways. Texas has about a 6-month waiting period for you to get your license. And then when you do get your license, you got to go, before you get it, you got to go to Austin, and you have to bring your medical school diploma. So you get it out of whatever you framed it in, you got to go show up. Other states can have a longer time to get the license. And so you need to start thinking about that right away. That's your first step. And if you guys are fellows right now and you're graduating in July, you're already behind. So start getting your state licenses in. Hospital employment, we'll talk about that first. Well, there's sharks in that water. You got to be careful. You're an asset or a liability to them. They're businessmen. And at first, I didn't understand the mind of the hospital administrator. And I'm going to try not to be so bitter, and I'm going to try not to be so angry about it. But you think, is it me? Do they not like me, or what's going on, or why are they bringing in competition? Why aren't they supporting me? I'm a bariatric surgeon. I bring a lot of money to this hospital. No, you're an asset or a liability, and unfortunately, a lot of times they see you as a liability. Which is not true. You are the cost generator. And the hospital, for each case that you make your fee on, they're going to make an average of 8.5 times that. And a surgeon will generally generate about $9 million a year for a hospital. And all you have to do is look at the number of rural hospitals that closed because they lost their surgeon. So remember those things when you're talking to these people. Yeah, you're an asset. Yeah, you're replaceable by other people, especially people that are cheaper than you, including fellows who don't know what they're worth. But if you go into that knowing what your worth is, then you can bargain and you'll come out happy like Dr. Choi, because he's obviously, you can tell he's happy where he is. And I think that's great. But you have to know your worth, and you have to know when you go into that room that you have to fight for yourself. All right. So a couple things to think about. Again, I'm not a negotiating expert, but you need to know what an RVU is. Does everyone know what that is? Is there somebody that doesn't know what RVU is? Perfect. All right. So you need to know your state average, and you need to know your national average. And even better, if you can find out what's going on in your community, that would be even better. Can they adjust the worth of your RVU at the point of your contract? Whoa, what? Wait a second, I have a contract. My contract says I get paid $45 an RVU. But doctor, you didn't produce this year. And we ran your numbers, and we're going to drop that to 38. And didn't you read that in your contract? It's a little subclause. Now, I'm making that up. There are contracts that actually exist like that. So be careful about things like that when you're reading this contract. You have to look at the length of the contract, and you have to have access to your production. Now, RVUs are going to be very important for a hospital-employed physician, but there has to be transparency. And when you ask for that information, it should be given to you in a timely manner. And that needs to be upfront in your prenuptial, not later. You can't find that out later that they're going to change the RVU on you because you didn't make your bonus, or that you can't get access to these numbers. Bonuses, how do the bonuses work? There's a surgeon in my town where he didn't, I guess, read the contract close enough, but he was supposed to be bonus quarterly, right? So he gets a base salary based on, and then he's got this RVU production, and he gets a bonus based on that. It's a pretty common thing to do in a contract. Okay, if he didn't make his second quarter baseline, they withheld the bonus from him, and in fact, they used the bonus from his third quarter to pay that. So at the end of the year, he was short by a whole quarter of bonus. So you think that these things are going to be straightforward, that everybody's going to play fair, and this will be like you just show up and you get your paycheck. It don't really work that way. And is call are you getting paid extra for that, or are you going to take extra call? And when you do get paid call, is it paid monthly, or is it paid at the end of the year, or does it go into a bonus structure? Just questions that you need to ask and be thinking about. Are you going to be at multiple hospitals? If there's a slower hospital in your community that's owned by the same healthcare company, are you going to be asked to go there where you're not comfortable? Maybe you get used to working with one team, and you're used to the floor nurses, and then all of a sudden you've got to go to another hospital. Find out from the doctors that are there what their renegotiation has been like. And people are generally pretty happy, especially people coming out of private practice and going to take an employed position. And they think, it wasn't that bad. I don't have that administrative headache. I don't have to worry about my employees, things like that. But that's the first 2 years to 5 years. It depends on the length of the contract. Try to get a longer contract. But what's renegotiation? Is it renegotiation upwards or is it downwards? And the people in the community should be able to talk to you. And if they don't want to talk to you about stuff like that, that's kind of a red flag. So what are your non-clinical duties? I was chief of surgery at my hospital. It's like a 400-bed hospital, I suppose, about 7 of the last 12 years. But you're sitting in a room with everybody getting paid except for the physicians, and it's night, and you're missing your time with your family, and you just had call, or you've got a case that you're waiting on, and somehow your time's not valuable enough to be reimbursed for. So what are the administrative duties, and is there some sort of bonus structure to that? Well, my bariatric time is important. I'm the medical director of our bariatric program, and I get paid a pittance. It's $177 an hour, but I can bill that, and I actually do make about $1,000 a month with clinical or non-clinical administrative duties from bariatrics. Make sure that you know about that going into that contract, because they will load you up with this. And being chief of surgery in a community hospital is not an honor. It's not anything great. I mean, people that have done it realize you're hurting cats. You have no enforcement power with these people. You don't even have an M&M. You could go to the medical board, but that's a crazy move to do that to somebody in your community. And if they're bringing money into the hospital, it doesn't matter how many scalpels they throw. It doesn't matter how many techs they actually push. What are you going to do? And so again, I don't want. I guess I do sound like a bitter old man, but you got to be careful. You got to be careful. Take care of yourself. Are there non-compete clauses when the contract's over? And what's your tail coverage? You need to think about occurrence versus claims made. Very important. I got to keep moving, or we're never going to make it to the other thing. Termination clauses. Can they fire you? What is the process to fire you? What's the process for you to leave? What about CME? Well, yeah, doctor, we're going to give you a stipend for CME, and you're going to have 2 weeks of a year that you can do that. In fact, we'll pay for your licensing. Okay. Are you going to pay it out of your pocket and ask for reimbursement? In which case, is it going to take 4 months? Or is this something that they'll pay up front? And those are important questions to ask. Because I've found that it's like an insurance company. They'll really drag their feet in paying you. And they'll deny about 1/3 of your claims just flat off just out the gate. But when they want a refund, that money comes right away. You have to pay that back. So it's the same thing. Just watch out for yourself. Can you have input into hiring and firing staff? What about terminating patients that are crazy or non-compliant? How can you do that? All right. Think about the average CEO salary. It's now higher than the average surgeon salary. And we have a growth of administration by 2,000% in the last 30 years. So they're paying for that by taking money from the system. It's a pie, and there's only so many ways you can slice it. Pie's not going to get bigger. So you need to lawyer up. You're probably not going to change a lot of the contracts with these big groups, but at least that lawyer can read the fine print or help you read the fine print so you know what you're getting into. But your only real and true bargaining power is to be able to walk away, to be able to say, well, look, I look at this contract, you guys aren't willing to budge, I'll just find somebody else. You kind of have to be able to do that. And remember, not one CEO can do what you can do. If they were reverse raptured and taken to hell tomorrow, because they're not going the other way, but sorry. Okay, but what would happen is the hospital would work. The nurses would show up. You would show up and you would do cases. The housekeeper would clean the room after you finished in the OR. It would all still work. But remember, at the very end, bad contracts will come to an end just like good contracts. So don't feel trapped. Don't feel lost. You're the engine. You drive the entire system, period. So their salary and bonus is based on what they take from that pie from you. So you're not that special. So get that through your head. You're an asset or a liability to them, so you're an interchangeable part, and if you go into it with those kind of attitudes like, okay, that's fine, but this is what I'm worth and this is what I need to be paid, you'll have a better negotiation. There's no real high ground. They see you as just one of these guys until they throw you out of the plane. All right, it's not the money you make that makes you rich, it's the money you spend that makes you poor. I think that's really important. Final thoughts about your negotiation. This is a nice Maserati. It's in the doctor's lot there, El Paso, Texas. Beautiful car. Well, who drives that? Here's a Ford Focus. You guys want to take a guess which one's the doctor's car and which one's the COO's car? Yeah. So, I just like this picture. Look, okay, you guys see this thing there? Let me push play. Okay, any thoughts about what that is? It's an entire chicken wing. She ate an entire chicken wing. It got obstructed. I just like that picture. All right, now what about group practice? I've been waiting for years to show that to somebody. All right. You thought that the sharks in the hospital were bad, huh? No, in private practice. But there's great jobs out there, and I don't want to paint too bad of a picture, but you got to be careful with people because you have to trust them. That's fine. You can trust them, but you got to verify. I think that's super important. Groups. Their overhead is never ending. My overhead never ends. I think about it. I stay up at night thinking about my overhead. How am I going to pay this? And how can I get one of you to contribute to my overhead so that I can make you pay a little more of mine? Now, that's not malicious. That's just the way private practice is, right? So it's okay to go with a large group. And you can probably trust these people, but you need to verify this. And you need to find what they want from what you want from them. So do you buy in? Well, what do you get? I hear about buy-ins all the time. What do they own a surgery center or do they own an x-ray machine that you get a portion of? What's the buy-in? Because insurance contracts are free. I mean, you call up an insurance company and you get on their panel. That's kind of it. There's not much negotiation with an insurance company. There really isn't because you're replaceable to them. All right? So retiring docs or referring docs have very short memories. They just want somebody to show up. 3 A's, we already talked about them. Affable, able, and available. And available is the most important one of all. It doesn't matter what fellowship you did. If they get along with you and you show up and take care of the patients, they'll refer to you. But it's a two-way street with these private practitioners, these big groups. They're not doing you a favor. You're helping them. You're helping them with coverage. You're helping their workload, and you're part of the overhead. So you got to negotiate with purpose, right? Don't be afraid to ask for things. You got to know about call coverage because there are going to be times when they won't cover your patients, or there may be times when they won't cover your. And you would think, well, I joined this group, aren't you? What do you mean I don't get a weekend off? Oh no, those are your patients. So just that has to be upfront. You have to know about the call stipend. You're expected to assist all the time and take the scraps. And you need access to your billing. And it's more important that you know about collections, not RVU, when you're in private practice. It doesn't matter what I charge. It matters what I get paid. All right. You got to protect yourself. No handshakes. No handshakes. Have a divorce clause ready. have a clear bonus structure, make sure about the malpractice, and there has to be transparency with everything. You've got to have a prenup. That is so important. Is there a non-compete clause? Maybe you do want to go back to your hometown. Now you're going to have to leave because you just broke up with this group. So what's the distance that they have and how long is it going to go for? When's the last time someone left? And find them if you can and ask them. These are uncomfortable questions because you're like, well, I want to make a good impression on this person. I respect him. You know, he or she's an older surgeon that has this established practice. But you've got to take care of yourself. All right, it's just like any relationship, right? But lawyer up. Okay, solo, you got to just be a masochist. I mean, you probably, it's still possible. You know, there's an income guarantee, that's a misnomer. What they do is they make you go to the bank. You get a line of credit, they co-sign, but you could have just done that yourself in a local bank. And you got to be prepared to work all the time. I took a week off after 7 years of practice. But if you don't work, your family doesn't eat. It's very clear. Like, my kids are so tired of hearing, like, and my wife, you know, she's a pediatrician. She wants a new person in Las Vegas. Do you know how many gallbladders that Louis Vuitton would be? Do you know how many gallbladders that would be? God, what the gallbladders again? And you could do it, but you got to have practice consultants. And the feds have decided they don't want private practitioners. It's the only way that you can interpret what's going on in medicine. So you've got to hire consultants. And you've got to become an expert in billing. You can, sorry, we're kind of running out of time. Don't trust anyone. Man, that sounds horrible, but you're committed, right? You got $100,000 of loans, $200,000 loan. You got to go through it, right? But no one's going to watch out for your interests except for you. So just, you know, be aware. So sorry, I didn't mean to paint a horrible picture of practice, but watch out for yourself because nobody's going to do it for you. And just be ready and ask uncomfortable questions. And Texas Tech is going to win the Final Four. So. All right, thank you.